My first guest is Dr. Jonathan Feddock, who is a radiation oncologist with Baptist Health.
Thank you.
Now, I use the term radiation, and people say, well, I've got cancer, so I'm going to get treated with radiation. Kind of tell us a little bit, when I use the term, what is radiation? What's it mean?
One of the things that a lot of people don't realize is we are actually exposed to radiation on somewhat of a regular basis. Sunlight, that's radiation. Every time that we go and we get an x-ray or a CAT scan, which a lot of people have had as a component of their cancer care or their diagnosis, that's a form of radiation too. We're just using specific machines and some naturally made radiation sources to actually harness that energy and deliver it, which can actually be used to treat cancer.
When you said specific machines, is there one type of radiation or different types?
So there's really kind of two main types of radiation. The most common one that people are probably familiar with, or what they receive when they get a cancer treatment, is something that's made from a machine called a linear accelerator. Very practical terms, this is a machine that takes electricity out of the wall, creates it into a form of radiation that we can direct into a patient, and we can shape it. We can turn it up or turn it down in its intensity and actually focus it on certain parts of the body.
So you can target the cancer.
You've got it.
Now, is there certain types of cancer that's better suited to radiation?
You know, I think what most people have to realize is when you're talking about cancer as a whole, we really have three main treatments: chemotherapy, surgery, and radiation. And all of our different cancers probably have one form of those treatments that's going to be the main treatment as a whole, but there's different situations based on the size of a tumor, the location of a tumor, where one treatment's going to be the main driver. So in general, if a tumor is small and it's easy to get to, we use surgery. In a lot of those other situations where, say, it's close to something very sensitive in the body, close to the brain, or in the brain, close to the spinal cord, harder to remove with surgery, we're going to be using radiation in those situations more often.
And it's not always one or the other. Sometimes you use them all three.
Right. So nowadays with our cancer care, we're really moving towards what we call multimodality care, where we're trying to combine all three of them so that the individual impact or side effects that one of them may pose can be reduced.
Now, one of the terms that a lot of people have heard is cyberknife. Is that a different type of radiation?
So I tell all of my patients, if you think about treating cancer like treating weeds, we have radiation treatments that are the whole yard weed killer, and then we have radiation treatments that are Roundup, only meant for small areas because they're highly concentrated. CyberKnife is a special kind of radiation treatment machine that's ideal for treating those small areas, or sort of like Roundup. Now, where it's different is most of our radiation treatments are built around this tenet that we're trying to get the patient to stop moving so that we can treat the tumor better. CyberKnife is actually a robot that actually tracks a person. So for example, if they have a lung tumor and as we breathe that tumor is moving, CyberKnife focuses on it and the robot moves the whole radiation unit back and forth. And in the end, it ends up being an easier, safer treatment for the patient with less side effects.
Now, you say treatment. Sometimes there's one treatment, 20 treatments. Is it depend on the cancer or the location?
A little bit of both. The way that radiation is delivered is ideally we deliver small doses on a daily basis that we spread out 5 days a week. And I would say the most average radiation treatment course is somewhere between 4 and 6 weeks. One of the reasons we do that is the less amount of radiation we give per day equates to less side effects for the patient. So if we're trying to treat, say, a larger area or a more broad portion of the body, stretching those treatments out over several weeks, again, will end up causing less side effects.
Now, you mentioned side effects. What are some things that you see as a side effect from radiation?
So by and far, I tell everybody I treat, you need to think about the side effects we're going to cause are very specific to where we're going to be directing them. So everyone, I think, has a family member or a friend or a colleague who's probably had a lot of sunburns from their radiation treatments, maybe some sore swallowing or difficulty with their sense of taste. That really happens when we give radiation in the head and neck or close to the throat. And in there, we're treating cancers that are very close to the skin surface, so we see a sunburn. But in other areas of the body, say in the pelvis or sometimes deep in the abdomen, we're not going to see a lot of sunburns. So what we tend to see is up around the head and neck, trouble swallowing, maybe some sore sense of taste. In the chest, maybe some sore swallowing. In the abdomen, maybe a little bit of diarrhea, nausea, more frequent urination. But by and far nowadays we're really focusing on treatments on ways that we can do them and such to minimize the side effects and use a lot of the additional medications that are available to keep them under control when they do happen.
That's great information, great alternative for cancer treatment. Thanks for coming in.
Thanks for having me.
We'll be right back.